Hi, my name is Carlton Kelly Williams, and this is my third article presentation for Dr. Toussaint's class. And my topic for my article presentation is forensic rehabilitation therapy. What is forensic therapy or forensic rehabilitation therapy? One of the quotes from the article was, describes the application, and I'm paraphrasing, but describes the application of psychological therapies to the management and treatment of mentally disordered offenders, meaning therapy that is specific to convicted offenders to help them work through any mental health issues or disabilities they may be dealing with. Who is it for? This therapy is specifically for forensic patients or patients who are offenders. It requires the help of several forensic professionals to intervene for the patient. It's different types of treatment, whether it be, supervising them, or, it just depends on the environment. But that's what that second bullet point means. These are just some of the different breakdowns of settings that are used for forensic rehabilitational therapy. High security, that's typically your hospitals and prisons. Medium security is regional or medium security units. Minimum securities are local forensic units. Non-secure inpatient units. Residential therapeutic communities and specialties in patient units. And lastly, non-secure outpatient units, non-residential therapeutic communities, day hospitals, and specialist centers. Some of the roles of forensic psychotherapy are, you have direct clinical work, which is directly working with forensic patients individually or in groups by assessing and treating them. You have supervisory work, supervising professionals or trainees as they undertake direct clinical work. Then you have clinical meetings, including case conferences, clinical team meetings, patient reviews. And lastly, consultations. Consultations are psychodynamically informed consultations provided to an institution from outside. Reasoning behind the assessments. Assesses the patient's potential to participate in treatment. Also to make sense of less conscious effects and beliefs that drive behavior in interpersonal relationships. To discover the patient's defense mechanisms. And lastly, to reveal unconscious thoughts and fantasies with respect to the offending behavior. You have treatment. The goal of treatment is to allow patients to discover the best version of the best decision for themselves, help them to develop awareness within themselves. This can be done through group therapy, individual therapy, treatment programs, and therapeutic communities. Just going back to what I kind of said in the beginning, this type of therapy is used to allow them to understand some of the things that they have done, also allowing them to understand, take responsibility for it, and also allowing them to come to terms with their decision, if that makes sense. And so, yeah, like I said, these things can be done through a bunch of different types of therapy, whether it be group, individual, treatment programs, and so on and so forth. And these are my works cited.